Today we introduced a new medical technique in Andorra, which is called Transnasal Esophagoscopy. This is a technique where we look through the nose and the throat into the food pipe and the stomach. It's a joint procedure between two specialties, including ENT and gastroenterology. I performed this procedure today with my colleague, Dr. Román Turró, who is the medical director from the Technon Medical Center in Barcelona. Dr. Turró, what did you think about the procedure?
Well, first of all, thank you for bringing me here. It's an honor to me, and I think that you saw it. It's a pretty easy procedure, and we got a very important information without being very harsh to the patient. It's a very, very minimal invasive procedure.
Exactly, I think this is the main benefit of the procedure compared to the classic gastroscopy, where patients need to swallow a really big tube, which is difficult to tolerate and which usually needs a degree of sedation, meaning the patient needs to go to sleep a little bit for the procedure. This procedure is much shorter, it takes about 5 minutes. Secondly, I think it's very well tolerated under local anesthesia sprays only. We spray a little bit of local anesthesia in the nose and in the throat, and the scope is much thinner and therefore much better tolerated by the patient. Is that what you feel as well?
Yeah, actually, I would add also that it brings as a previous procedure, it avoids potential more invasive procedures to other patients, to the ones that you just like have a normal exploration. It's not needed to go forward deeper.
Exactly. And which patient do you feel are best benefit best from this procedure?
I think that based on this joint that we are talking, patients that they are like suffering of reflux could be a good candidates to be studied with this kind of procedure. Absolutely.
Yeah, I think this is an important point. In ENT, we get a lot of patients who come in with throat problems, having a sensation of a lump in the throat, constant urge to clear the throat from copious phlegm. And I think these are patients that, in my opinion, in my experience, have reflux, meaning acid coming from the stomach to the throat, as a cause of these throat symptoms in about 90% of cases. But of course, we always need to exclude other causes of throat problems, such as throat cancer, for example, in the worst case scenario. In the olden days, I would just be able to offer the patients only a flexible laryngoscopy, which is an endoscopy where we look through the nose only to the voice box and the throat. And I would not know if there's any problems more down below, for example, in the food pipe or in the stomach. The advantage of this procedure is that I can offer the patients a full examination from the tip of the nose all the way down to the stomach. So, Dr. Turró, I'd like to thank you for coming here today to Andorra, all the way from Barcelona, and doing this procedure together. I'm looking forward to our future collaboration. I think our plan is to bring this technique to Andorra and develop it further, and offer patients a way of undergoing a gastroscopy in a way that is much more tolerable.
Thank you so much again. It's an honor for me to be here and to have met all this team, a magnificent team. And then also, as we mentioned before, it's the beginning of a long-term relationship.
Thank you very much.
You're more than welcome.